Happy New Year, my wealth makers in training. Welcome back to another episode of the Do.Different.Better show, where we talk about wealth, wisdom, and money moves, making finance simple for everyday people. I'm your host, Elaine Rasmussen, CEO and founder of Social Impact Now, Connective Institute, and the managing director of the Integrated Capital Fund, and your trusted guide to making smart moves with your money. Thanks for joining me today. Today, we're diving into a hot button issue that's making headlines, and that is healthcare reform. Yes, we're talking about the dollars and cents of managing your healthcare costs and the potential changes that may be coming our way. Now, why does this even matter? Well, because healthcare is one of the biggest expenses we all face. And with reform debates reigniting after the election, the policies at the table could dramatically impact your wallet. And I can't let that happen to you. Here's a fun fact to kick us off. Did you know that in the United States, we spend about 20% of our GDP, that's over $4 trillion on healthcare? That's more than any other country, and it directly impacts every single American person's finances. In this first segment coming up, we're going to talk about the current state of healthcare, what's driving costs, and key proposals being discussed in Washington. By the end, you're going to have a solid understanding of the landscape so you can start preparing for what might be coming next. So let's get into it. All right, let's start with where we are right now. The US healthcare system is a patchwork of public and private options. And while it's one of the most advanced systems in the world, it's also one of the most expensive and inequitable. If you're lucky, you've got an employer-sponsored health insurance program, which covers about half of Americans, right? That means you have a job and at your place of work, they are offering some sort of health insurance benefit. Then there's Medicaid, which is for low-income individuals and families. There's also Medicare for seniors. And then there's an option to buy insurance through the Affordable Care Act marketplace, or what is commonly called Obamacare. But even with these options, millions of Americans, maybe even you, remain uninsured or underinsured. So, what's the problem? For starters, premiums and deductibles and out-of-pocket expenses are skyrocketing. The average American family with employer-sponsored insurance spends over $22,000 annually on healthcare related expenses. And if you're self-employed or relying on the Affordable Care Act marketplace, those costs may be even higher. Let's not also forget prescription drug prices, another pain point. The US spends more per capita on medications than any other country. Thanks to limited regulation on drug prices and patent monopolies by large pharmaceutical companies, sometimes referred to as big pharma. And while some people may have some decent coverage, the system leaves major gaps that are disproportionately impacting low-income families, communities of color, and small business owners. If you're juggling multiple priorities, kids, a mortgage, retirement savings, healthcare costs can derail your financial goals. So, why are we even here? It's really a mix of rising costs all the way around, inefficient systems, and a lack of universal access. That's why reform is back in the spotlight and on the table. So now let's make a shift into what are some of the solutions, or at least what's being proposed. There are three main camps when it comes to healthcare reform. The first is Medicare for all. You may have heard that in the news, talked about on one side or another of the political spectrum. This proposal would expand government-funded healthcare to cover all Americans, eliminating private insurance altogether. Advocates say that it would simplify the system, reduce administrative costs, and guarantee coverage for everyone. But critics argue it could lead to higher taxes, longer wait times for services, and reduce innovation in the private sector for new drug therapies and interventions. The system is often compared to what is offered in the United Kingdom or Canada's National Health Service. Option number two, which is generally called the public option. This is the middle ground. This plan would add a government-run insurance plan alongside private options, allowing people to choose what works best for them based on their family structure, their health needs, etc. Supporters say it could create competitive and lower costs, but detractors worry it could destabilize private insurance markets. And many don't have confidence in the government's ability and track record in managing large scale programs, regardless of the political administration. Number three, market driven reforms. On the other side, you've got proposals focused on increasing competition, reducing regulations, and giving consumers more choices. This approach leans on the free market to drive down prices, but often leaves gaps for low income families and individuals who can't afford higher premiums, particularly blue collar workers. What's interesting is that these proposals are often shaped by political ideology more than practical solutions. The public option, for example, is supported by moderate Democrats, while progressives are pushing hard for Medicare for all. On the other hand, market driven reforms are typically championed by Republicans and libertarian groups. As with anything, there are pluses and minuses with all of these options. None of them will make all the people happy all the time, right? But here's why it matters to you. These policies will affect everything from the cost of your premiums to the taxes that you pay. They could also impact the broader economy, including the job market, in the healthcare sector, and profitability of healthcare stocks. And if you're invested in those, that's where you're going to see some of the financial impact or implications. So, how do these proposals impact you specifically? Well, if Medicare for all becomes a reality, you might pay higher taxes, but your out of pocket costs for healthcare would actually disappear. So that $22,000 I talked about a little bit earlier, that would go away. For middle class families, this could mean some really big savings. A public option could offer more affordable coverage to people who can't get employer sponsored insurance, like employees of small businesses, but there's a risk it could drive up costs for private plans. And if market driven reforms take center stage, you might see lower premiums in your health care, but higher costs if you have pre existing conditions or need comprehensive care, particularly as you age. Let's not forget small business owners who often struggle to provide available health benefits to employees. Depending on the policy, this group could see significant changes, good or bad, in how they manage healthcare costs. So, I hope that this conversation is really getting you to kind of see the larger landscape as to what the larger healthcare expansive opportunities are, and how they might impact you. What's really important to know is as you age, your needs are going to change. The general trajectory is as you get older, you have more healthcare expenses. So while you might be a young person and you're like, hey, Medicare for all works for me, as you age, maybe you get to 40 or you have a significant health crisis, maybe something comes up that you had no idea that was a hereditary thing, or something that you experience a health crisis that has nothing to do with hereditary. And I will just tell you, as somebody, I had a loved one in 2020, very healthy person, works out every day, takes care of themselves, eats healthy, and was diagnosed with throat cancer out of the blue, out of nowhere. And it was almost not caught. And so you never know when a catastrophic event, or what could be a catastrophic event, is going to happen. So while a plan might work for you at one age in your life, it may not work for you as you age. So I just wanted to walk you through that. This is a very complex issue because um, these things will shift and change not only from community to community, but it's going to be based on your own personal circumstances. Do you have an employer that offers health insurance? Do you have an employer that's not able? Maybe you're working for a small nonprofit that doesn't offer health insurance. So one plan versus another might be acceptable to you. However, you may have a partner that has an employer sponsored program, and it just makes more sense for you to be on that plan versus something else. But not everybody has a partner that is self-insured. Maybe you're living in a household of two entrepreneurs, two small businesses. And so that is not necessarily an option for you to not only cover your own health care expenses, but the healthcare expenses of your employees. You just may not be driving the revenue that allows for you to do that. So once again, this is, I hope you take away from this conversation that it is not a one size fits all. It's not even a one size fits all for an individual person, because as you age and as your life changes and you have different sorts of crises that might happen, or just different kinds of developments in your health medical history that will then impact which one of these options would be optimal for you. So as you were hearing some of the rhetoric and some of the news that's happening, I really just want you to take into consideration that every single person is dealing with a different deck of cards, that they're all trying to make a decision around what this looks like. And as you think about to your elected officials, I hope you can take that into consideration, that not everybody is sitting in the same position that you are. And so as we think about healthcare reform, whether it's in your state or whether it's at the federal level, that we really have to think about, maybe we think about a multi-plan option. Where are the opportunity for the most people to have the most access at a price that they can actually afford it, with drug care costs that they can actually afford? Because if we keep going the way that we're going, we're going to have some detrimental impact to our healthcare, which we're already experiencing. We have the highest obesity in the United States. However, we're also living longer. So if we're living with some of these long-term detrimental health implications, how is this going to be covered, whether it be through your own dollars or we're covering through tax dollars? But the whole idea is really, really thinking about and understanding how it impacts you, how it impacts your family, but also considering how it might impact your family. Are you living in a low income community? Then your community needs something different than maybe somebody who's living at a different, wealthier, healthier stage of life. So, but here's what I want you to do. Here's my call to action for you, right? Take a hard look at your current healthcare expenses. Are your premiums eating up too much of your paycheck? Are out-of-pocket costs cutting into your emergency savings or your financial investment plan because you've been listening to the show? If so, the reforms that are being debated could directly impact your financial future dramatically. So definitely stay on top of the conversation, but also stay on top of like what is happening and what kinds of expenses might you be anticipating based on your own medical history, your family medical history, so you can start to prepare for that. You're listening to Do Different Better. I'm your host, Elaine Rasmussen. Stay tuned for the next segment, where we'll dive into actionable strategies for managing healthcare costs and preparing for policy changes. You're not going to want to miss it. I'll see you after the break. All right. Welcome back, my savvy healthcare strategists. Now that we've set the stage for the current landscape of healthcare and the policies that are being proposed, let's get into what you can do about it. Because let's face it, whether change is coming next year or in the next 5 years, these costs are going to be hitting your wallet right now. So, how do we navigate this? By taking control of what we can manage, our personal healthcare budgets, smart financial moves, and the resources available to us today. These are all the things that are going to help us really be able to manage not only your healthcare costs today, but any anticipated healthcare costs in the future. Here's a fun fact. Did you know that 1 in 5 Americans has medical debt in collections? I was one of those people. I thought I would never get all of my medical expenses out of collections. I finally did, and it was a happy day. I think I did a happy dance all over my front lawn. But yes, even folks with insurance find themselves with expenses that then go into collections because they're trying to manage all of their regular expenses on top of maybe an unexpected crisis that has generated a medical bill that they now have to pay for. But that's why it's critical to have a game plan in managing your healthcare expenses. This segment is all about actionable strategies to make healthcare more affordable for you and your family while staying ahead of rising costs. Okay, so first of all, here's tip 1. Let's start with the basics. Preventive care. Most insurance plans, whether they are private or are government run, offer free or low-cost preventive services like annual checkups, vaccinations, and screenings. These services can catch health issues early before they turn into costly emergencies. So here's an example. A routine cholesterol screening, which might be free to you on your plan, may cost you nothing out of pocket. But if your cholesterol goes unchecked, and I literally had a friend of mine who is a contractor, he came by to visit and was telling me that he's a contractor. He's out there, lugging lumber. He's a general contractor. He's lifting things. He's actively moving his body. He's walking around. He gets like 15,000 steps a day. Turned out he went in for a routine checkup. His cholesterol level was at 300. And if you're not familiar with cholesterol levels, 300 is dangerously high. He didn't feel like he had a problem. But had that gone unchecked, he would be looking at potentially some heart issues, maybe I had another friend out of the blue had a quadruple bypass surgery, right? Literally seemed like a healthy guy, had, worked out regularly, ate really good, clean food, and was having some pain in his chest, went in to have it checked out, went into emergency surgery for a quadruple bypass. And just think about that expense could rack up tens of thousands of dollars in medical bills, not immediately or down the line, right? So this is why you want to take advantage of those free screenings that are offered through any preventive health insurance. So here's my action step for you. Check your insurance plan to see what preventive services are covered. I want you to schedule that checkup right now. You may not be able to get in for a while. Doctors are really booked up right now. I know this myself, but I don't care if your appointment is 3 months from now. Book it now book it now. I just want you to book it now. But schedule your checkups for women, your pap smears, your mammograms, even your colonoscopy. I had my first colonoscopy last year. It wasn't as bad as everybody makes it out to be, but I definitely encourage you to do that. Once again, it's going to, what could cost you nothing today will put you on a path to minimizing big expenses later on. This is really about not just about your health, but also protecting your wealth, right? So here's another tip. If you're uninsured or underinsured, look into community health clinics or public programs in your area. Many offer sliding scale fees based on income to do your preventive care and making it accessible to everyone. They also might have free preventive care opportunities. So a lot of times they have them listed on their website. So it might be, hey, offering free mammograms, hey, offering free pap smears. So take advantage of those, particularly if you're underinsured or uninsured. And just go into Google and say, hey, preventive services near me. Or if you know that you have a family history of a particular medical condition, put in that medical condition, free screenings near me, right? Or within a 20-mile radius. Really, especially if you know that you have a family history of a particular disease or chronic illness, definitely taking advantage of some of these free screenings will be for you. And once again, it'll just save you a lot of heartache and a lot of money if you can get these things taken care of when they're early in stages, instead of finding out at the last minute and there's nothing that can be done about it. So now, next up, let's talk about tax advantage accounts like health savings accounts, HSAs, or flexible spending accounts, FSAs. These are powerful tools in saving money on healthcare costs while reducing your taxable income. Here's how they work. HSAs are tied to high deductible health plans. You can contribute pre-tax dollars, letting them grow tax-free, and withdraw them tax-free for qualified medical expenses. FSAs are similar but are offered through employers and are typically you have to use it or lose it rule each year. So here's an example. Imagine putting $3,000 into an HSA annually. Not only do you save on taxes upfront on your paycheck, you can invest those funds for long-term growth, kind of like a retirement account for medical expenses. And these are specifically for and only can be used for medical expenses. Once again, if you know that you have a family history of a particular condition or a particular medical disease, definitely knowing and saving now for what could be potentially an issue in the future. But here's the great thing. Let's say you get to that point in your life and you don't have that condition, but you have children. You can still use the money in that HSA for your children's medical expenses, right? So it's a win-win. But here's the bonus. HSAs can be used for a wide range of expenses, from prescriptions to dental work, even eyeglasses. And if you don't use the money right away, it rolls over indefinitely. Here's an action step I'm going to give to you. If you're eligible for an HSA, max out your contributions. For 2025, individuals can contribute up to $44,150 and families up to $8,300. Now, that number is as of the recording of this show, which will be at the beginning of January 2025. Be sure to check your family plan or check your insurance plan to see if those numbers have increased or decreased. They rarely decrease, but if the numbers increase, max it out as much as you can in whatever way that you are able to based on your family budget. For FSAs, plan your annual contributions carefully based on expected medical expenses to avoid losing any unused funds. For example, you are going to need glasses. Glasses, your plan may say you can get glasses every other year, right? So in the off years, you might want to save more money. Then on the on year, you'll want to expend that money for your glasses. And I don't know about you, glasses are running pretty expensive. I have a couple of websites that I use that are incredible that make it affordable. But I remember the last time I bought a pair of glasses for my son when he was 15, they were $400. I've since found a much more cost-effective way to buy glasses. But if you're still buying your glasses from the optometrist, they can be really spendy. Or if you're very fashionable with your glasses, they can be spendy. So being able to have these FSA dollars to be able to buy those glasses or dentures or other implants or cleanings or root canals or things like that, an HSA and an FSA are going to be really, really helpful. So here's tip number 3. Shop around for services and for prescriptions. Okay. Did you know that the cost of medical procedures and prescriptions can vary dramatically depending on where you go? Yes, even in the same city. If you've ever paid out of pocket for some sort of testing, like whether it be a blood draw or an MRI, you know what I mean. It can cost $500 at one clinic and $3,000 at another clinic. That's why shopping around is so important, particularly if you have the time to do this. Start with tools with like Good RX for comparing prescription drugs and finding coupons. Some insurance companies are now offering it as a service. There's also Healthcare Blue Book for estimating the fair price of medical procedures in your area. These are not sponsored and these are not an endorsement. Definitely do your own research. But my point being is that I want you to just don't just go book an appointment and not know how much you're going to pay for that particular expense, especially if you have a high deductible on your medical insurance plan. Here's a pro tip. If you are paying out of pocket, don't be afraid to negotiate. Ask for a cash discount or a payment plan. You will be surprised how often healthcare providers are willing to work with you. Their objective is to get paid, not to not get paid and send your account to collections. But this often requires you to be proactive. Don't wait till your bill has already gone into collections and then you're paying collection fees, you're paying finance charges. Really think about when you get the bill, where are you sitting financially? Have you just had a major car expense? So maybe right now you normally would have had the money to pay the bill, but you just don't have it right now. Maybe you've had some other kind of unexpected expense that you have to take care of. So once again, call the healthcare provider, say, hey, this bill is $1,000. Can I make $200 payments over the next 6 months? You just never know. But the whole idea is to be proactive and see what you can negotiate. The next time, here's another action step. The next time you have a medical procedure or need a new prescription, take 10 minutes to shop around and negotiate. This small effort could save you thousands or hundreds or even thousands of dollars in your pocket that you can then use for other things like investing. Okay. So here is another tip, right? If you are paying out, I'm sorry, tip number 4, leveraging your employer and government resources. Please, 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 please do not leave money or resources on the table. If you do have an employer sponsored insurance plan, take advantage of all that's offered. I have a friend of mine who worked 30 years in healthcare, and what he shared with me is that only 12% of people who are under an employee sponsored insurance program take care of some of the advantage available value added programs that the insurance company offers. Many of these healthcare institutions provide wellness programs, gym memberships, or discounts on health services as part of their benefits package. At the last organization that I worked for, if you checked into the gym 12 times a month, you got a 50% price reduction in the gym membership. And the gym that I was a member of was fairly spendy. And so having that 50% discount, one, I was highly motivated to go to the gym at least 12 times a month, which is comes out to be 2 or 3 times a week. That's really, really doable, especially since my gym had a sauna. So even if I didn't work out, I could get credit for going to the sauna. That's wellness. I think so, right? But once again, sometimes they will offer free screenings, particularly around, they'll send you colon cancer screenings in your mail. You don't even have to go anywhere. But taking advantage of these programs costs you nothing. There's no extra cost on your insurance. There's not even an extra cost for your company for providing. It's all part of your benefits package by the insurance company. So if you haven't looked them up, go look them up and use them. My insurance company just created a partnership with the app called Calm, which is a mental health wellness app. And so I get a free subscription. As long as I have this insurance, I get a free subscription to Calm. Will I use it? I don't know, but I opened an account because I never know. I might use it. And so it's better to have it available to me than to not have it. And it costs me absolutely nothing. It's already paid for in my insurance premiums, right? So if you are self-insured or uninsured, look into some government programs like Medicaid or CHIP, which is the Children's Health Insurance Program, or the Affordable Care Marketplace plans. They're usually distributed through your state. I live here in Minnesota, so we have what's called MinSure. That's the name of our marketplace. You can go on there. You can even compare what you're paying with your employer-assured plan and see what's being offered on the marketplace and see what's really the best deal. Once again, I want you to be smart about your money so you can start investing it for the long haul. Depending on your income, you may qualify for subsidies that significantly lower your premiums, right? So here's a real life example. One of my listeners wrote in about saving $300 a month on her Affordable Care Out Marketplace plan just by updating her income and reapplying during the open enrollment period. For many insurance plans, the open enrollment period either just closed or you might have about 30 till the end of January to close on your enrollment. But once again, that's real money back in your pocket. You think about $300 a month, 300 times 12, 20, that's $3,600. That's enough to start getting onto and starting your investments, putting it into the stock market and watching that grow, or getting life insurance. So once again, there's lots of opportunities, but you've got to be looking for the opportunities of where you can move money from one place into some longer lasting investment opportunities, right? So here's another action step for you. Review your benefits package or visit healthcare.gov to see if you qualify for subsidies or better plans during the open enrollment period. If you have just missed your enrollment period, I want you to go find out from your employer or go look up on the plan that you're interested in possibly participating in and find out when the next open enrollment period is. And I want you to put that as a calendar date in your calendar, whether you use, no matter what calendar feature you use, put this on the calendar. A lot of these programs will also have what are called qualifying events. What a qualifying event is, the enrollment period may have closed, but a qualifying event maybe you adopt a child, you foster a child, you have a child, you have a divorce, but some major life event that requires you to reevaluate your insurance coverage or your insurance plans, insurance options. So usually the company will tell you what those qualifying events are, what could qualify as an event that will allow you to enroll outside of the open enrollment period. So once again, you can look at those as an option as well. If you know that you're going to have a major life change soon, you can use this as an opportunity of like, hey, the open enrollment period has closed. I know that I'm going to have this major life event that is a qualifying life change event that will qualify me to go and seek out enrollment even outside the enrollment period. So these are the things that I want you to be looking at. Okay. We have covered a lot of ground: preventive care, tax advantage accounts, shopping smart, and maximizing benefits. The key takeaway: you don't have to accept rising healthcare costs as an unavoidable burden. With the right strategies and tools, you can take control and protect both your health and your wealth. But we're not done yet. In the next segment of Do Different Better, we're going to talk about long-term strategies for future-proof your finances against rising healthcare costs and the policy changes. You're not going to want to miss it, so stick around. Welcome back, my future-focused finance pros. We have talked about how to navigate today's healthcare costs and take advantage of tools available right now. But here's the deal: healthcare isn't getting cheaper, and with all the policy shifts on the horizon, it's more important than ever to have a plan for the long haul, especially as we get older. And we know that there's a correlation between healthcare costs and age. So as you age, more things start to like break down and those become very expensive. In this segment, we're going to be diving into strategies to future-proof your finances against rising healthcare costs. Think of this as a long-term playbook to protect your wealth while getting the care that you need. So grab that pen and paper or your favorite digital device because you're going to want to take some notes. You might want to bookmark this episode so you can come back and listen to it later. So first up, let's talk about often overlooked financial safety nets, and that is a healthcare emergency fund. You may have a regular rainy day fund, but you might want to back that up with a healthcare emergency fund. Why do you need one? Because even with insurance, unexpected medical costs can wreck your budget. Deductibles, copay, out-of-network charges, they can really add up fast, particularly if you need to see a specialist. Excuse me. So step one, calculate your out-of-pocket maximum. This is the most you'd pay in a year with your current insurance plan. Let's say your plan has an out-of-pocket maximum of $6,000. Make that your healthcare emergency fund goal, right? You might even want to keep it at a very specific bank or in a separate account at your current bank, right? So that once again, you don't make it easy for you to get to, you don't make it easy to transfer money back and forth into that account. Make it as difficult as possible to get those funds, right? Step two, start saving now. Treat this fund like any other emergency savings fund, but earmark it specifically for medical expenses. Use a high yield savings account to earn interest while you build your cushion, maybe even using a certificate of deposit, a CD that has a time limit. So once again, you can buy a 9-month CD, a 12-month CD. There's even longer CDs where, as opposed to a savings account, you're going to maybe get more interest by putting it into a CD, and that can serve as your emergency savings account. Now, there is implications if you have to take that out early, but once again, if you have a timeline of when you might be expecting that emergency, or once again, you're putting it in and you might want to just turn it over after that time period is over. So every night, if you're using a 9-month CD, every 9 months, you're just going to flip that over, and whatever interest you've gained, now you're going to gain more interest because it's going to be compounded, right? Here's a tip. If you have an HSA, that can double as your emergency fund since the money rolls over year over year. So here's my action step for you. This week, I want you to review your insurance plan and set a target amount for your healthcare emergency fund. Even if you start with $25 a month, right? And I've told you the story of how I started. I started with like $5, $10 a month. But by doing this, you're building a shield against future medical debt, right? And we talked about 1 in 4 Americans is experiencing some kind of medical debt collection, right? And I don't want that to happen to you. Next, we're going to be talking about investing and how investing can help you tackle long-term healthcare expenses, especially in retirement. Have you heard of the Fidelity Retiree Healthcare Cost Estimate? It says that 65-year-old couple retiring today will need roughly $300,000 to cover healthcare costs in retirement. That's a staggering number. But here's the good news, you can plan for it. So here's the first strategy, and I'm going to give you 3. Maximize tax advantaged accounts. We touched on this a little earlier, but let's dig in deeper. HSAs, right, are a secret weapon for healthcare in retirement. After age 65, you can even use HSA funds for non-medical expenses without penalties, though you'll pay income tax on those withdrawals. Don't forget your IRA or 401k, which can also help fund healthcare if you allocate them wisely. Okay. Strategy number 2, diversify your investments. Healthcare costs tend to rise faster than inflation, and inflation usually rises at a rate at 3 to 4% a year, right? So consider investments that can outpace inflation, like stocks and certain types of real estate. So just to be clear, we talked a little bit about inflation on the previous episode. Inflation happens every year. What we have been experiencing over this last year and post-COVID is a higher level inflation than the norm, right? So, but just to be clear, inflation happens every year. Doesn't matter who's in office. It doesn't matter what the political policies or political leanings of the administration are. Inflation happens every year, and it usually happens at a 3% rate every year on average. What we're experiencing now, when people start talking about and getting their hair all up in a tizzy about inflation, is because the inflation is actually outpacing the norm. So what we've been experiencing is like 6, 7, 8% inflation, right? So that is why people are talking about it more. But we experience inflation all the time, every year. It is why the cost of things goes up every year. That is natural inflation. When we get into something that's unnatural or supernatural, that's when the Federal Reserve steps in and they start adjusting interest rates on our loans or loan products like car loans, like home mortgages, things like that. So I just wanted you to be clear about inflation isn't something that just it happens as an isolated event. It's happening all the time, but it can expand, and then it needs to be dealt with at the Federal Reserve level to keep it in check, to make sure that we're not devolving to a developing country, right, where our currency, it doesn't have value. So, and the last strategy that I'm going to give you is strategy number 3. Consider long-term care health insurance. If you're in your 50s and 60s, long-term care insurance can help cover expenses like nursing home or home health aides. The earlier you buy, the cheaper it's going to be, because many of these insurance plans are going to be based on age. They're going to be based on lifestyle. They're going to be based on where you live, and that will indicate the price. So what you're going to pay as a 30-year-old for long-term care insurance is going to be less than what you pay as a 50-year-old, which is less than what you're going to pay as a 60-year-old, which is less than what you're going to pay as a 70-year-old. But the whole idea is, as you age, the likelihood that you may need some sort of long-term care, whether it be a nursing home, it could be if you have Alzheimer's or dementia that runs in your family, you may want to invest in long-term care insurance, because if you need to be in a facility, a memory care facility, they are not cheap. I will just tell you, my mother-in-law, who passed away last year, was in a facility that cost about $8,000 a month for her care. So it is not cheap. And that price, as I mentioned, that price at minimum is going to increase by 3% every year, if not more. So I want you to be financially prepared for that. So here is an action step. Set up a meeting with your financial advisor to integrate healthcare costs into your retirement plan. A good wealth advisor or financial advisor typically is going to ask you that question anyway. Do you have any chronic health issues? Do you have any hereditary health issues that you feel that you may need to plan for? And they will put that into a matrix to be able to calculate how much money you should be putting away today to be able to make sure that those expenses are covered. Ask specifically about HSAs and long-term care insurance options and how they might be able to support you in that financial plan, savings plan of making sure that you can cover all of those expenses, right? So the other thing I want you to consider doing, or here's another action step for you, is if you are with a larger company, particularly, and you have a corporate sponsored insurance plan, talk to your human resources person and find out what are all of the added benefits that are offered. They usually will have some literature or can point you to a website to find out what are some of the options. So many companies, like when I was working in the workplace, especially when I was younger, many companies automatically provided some level of long-term care. It wasn't a lot, but it's something you sign off on when you get hired and you never see it or hear it about it again. So I want you to go visit your HR department and ask them, like, hey, do we have long-term care that's already part of my package? How much is that? And then bring that conversation of what you learn to your financial advisor. Or if you don't have a financial advisor, now you have a number. A lot of times it's a very small amount. Maybe it's $10,000, $20,000, $30,000, but that's something. And you want to find out, if you ever leave the company, how much would it cost to continue with that insurance plan. Sometimes once you leave the company, it's no longer available, but sometimes you can continue up those premiums after you left the company because you've already put into it already. So it could be a situation if you don't continue it, you've lost all the benefit that you've accrued when you leave the organization. So finding out whether or not you can continue paying the premiums once you've left the organization and what might be the estimated cost of those premiums could definitely help you instead of finding a whole brand new long-term care policy, right? And having to start all over again. Okay. Now, navigating healthcare policy changes, right? Here's the reality. Healthcare policies will continue to evolve, and those changes will impact what you pay and how you plan. Staying informed is your best defense, right? So here's tip one. Watch for changes in Medicare and Medicaid. They are keeping an eye on any of these reforms could affect Medicare premiums and your coverage. Medicare expansion in certain states can also impact eligibility and benefits for other things. Tip two, stay engaged during open enrollment and periods. This is your chance to choose the best plan for your needs, whether through your employer or the Affordable Care Act marketplace or Medicare. Look for plans with lower out-of-pocket costs if you anticipate high healthcare needs in your future. Tip three, advocate for transparency. Push for price transparency. Push for price transparency in healthcare, whether it's asking your provider for cost estimates up front or supporting policies that make healthcare pricing clear. And remember, knowledge is power. Follow reputable sources like Kaiser Family Foundation or the Commonwealth Fund for updates on healthcare policy. So here are some of my final thoughts and some key takeaways that I want you to think about. One, start building a healthcare emergency fund today, not tomorrow, today, okay? It's your first line of defense against unexpected expenses. Two, invest strategically to cover long-term healthcare needs, focusing on tools like HSAs, IRAs, and even long-term care health insurance or long-term care insurance. Number three, stay informed about policy changes and take advantage of open enrollment periods so you can get the best deal that you possibly can and the best coverage that you possibly can. These are all very accessible things that anybody can do. But also I want you to go, my fourth tip for you, I just kind of thought about this on the fly. I want you to go and find out what coverage, if you are with an employer and you have an employee sponsored program, I want you to find out the full list of benefits that you have. Do you have long care insurance that's part of that? Do you have a death benefit that's a part of it? Do you have a life insurance that's a part of your benefits package? And calculating what the value of all of those things currently sits at, right? Do you have a life insurance policy that's worth $100,000? Document that. Make sure you download all the paperwork for that, and all that paperwork is stored in a very safe place. And you tell people, your partner, your children, where those documents are so they can find them easily. Because if you are incapacitated, they are going to need access to that information. Okay. As we're kind of like wrapping up here, your action step this week, pick one of these strategies and put them into motion. Whether it's setting up a savings account, adjusting your investments, or researching policy updates, take that first steps towards future proofing your finances. Well, that's it for today's episode of Do Different Better. Today we discussed um, healthcare costs that may seem daunting, but with the right strategies, you can navigate them without sacrificing your financial goals. If you've enjoyed today's episode, don't forget to subscribe, leave a review, or share this episode with somebody who could use a healthcare financial glow up. Let's keep doing different, better, and building wealth one smart move at a time. Let me know what you think of the show. We love the comments. Let us know how this has helped you. Let us know how this has helped you. And if there's somebody you want me to interview, or if you've got a question, hit me up on LinkedIn or Instagram at Do Better with Elaine. Until next time, stay healthy, stay wealthy, and keep making money moves.